Again, so my name is Tyler Gilland, and I am with MetLife. I do want to thank you for having me today to go over your dental PPO coverage, your life and your AD&D coverage, and your vision coverage. So first we will go over your dental PPO coverage. So with MetLife, we do have a large network of providers. And like I said, we do strongly encourage you to use those in-network providers, but with our PPO plan, the great thing is you can use any provider you like. Also, if you do use one of our in-network providers, you will save these 15 to 45% thing going out of network. We do ask that you do pre-estimates, and we also do have 24-hour customer service. So those are some of the key features about MetLife. So you are offered two dental plans with MetLife. You have your base plan and your buy-up plan. First, we're going to go over your base plan. So the base plan does have your preventive services, your basic services, your major services, and your orthodontia. So with your preventative services, if you do stay in the network, we will cover 100% of the fees. And your preventative services that's like your exams, your cleanings, your x-rays. Now your basic services, if you stay in network, we will cover up to 80% of the fee. And that's like your fillings. Your major services, if you stay in network, will cover up to 50%. And the major services are like your implants, your crowns, your bridges, your dentures, and stuff like that. So each person will have a $50 deductible, and the deductible only applies to your basic and your major services. It's not for your preventative or your orthodontia. Now, you will have a $1,000 annual maximum for your A, B, and C services. And for the orthodontia, we will cover 50% if you do stay within the network. And you will have $1,000 of a lifetime benefit for the orthodontia, and the orthodontia is for your children up to age 19. And the good thing is, I have been told that if you have maxed out in your previous plan, that your orthodontia will start new with MetLife, effective 7/1. And also, like I said, if you do go out of network, that's fine. Like I said, we just encourage you to go in network because said it's less out-of-pocket expenses for you. Then also afterwards, if you do want to find out if your provider is in our network, I'll be more than happy to look on and to see if your provider is in our network. So like I said, out of network, we'll go by the reasonable and customary fee. It's 100% for your preventive services. The basic services, it's a little lower. If you go out of network, we cover 60%. And the major services, a little lower, will go up 40%. The deductible is the same as $50 per individual. Your annual max for your A, B, and C services is still $1,000 per person, and your orthodontia is still the same at 50%. And your orthodontia lifetime maximum is still $1,000. Next, let's go over your buy-up plan. The buy-up plan is a little bit of a richer plan. So, like I said, this also has your preventative, your basic, your major, and your orthodontia services. Same thing with the preventative services. It's 100% in-network and out-of-network. The basic services, it's a little higher. We'll cover 90% of the negotiated fee if you do stay in-network. And for your major services, we will cover 60% of the negotiated fee if you decide to stay in-network. Deductible is still the same as $50 per individual. And your annual maximum benefit for the year is a little higher. It's up to $1,500 per person. Now for your orthodontia, it's the same at 50%, and your orthodontia lifetime maximum is a little higher at $1,500. Like I said, the base plan is $1,000, buy-up plan is $1,500. Now, say out of network, it's like say the same for the preventative services. The basic services, if you decide to go out of network, will cover 80% of the reasonable and customary fee. Major services will cover up to 50%. So, like I said, deductible is the same, annual maximum is the same for your A, B, and C services, and your orthodontia is the same at 50%, and your $1,500 lifetime maximum for the orthodontia is the same as well. Okay. And also with the dental, we do at MetLife ask you if you are going to need services that you think are going to be over $300. We ask you just get a pre-estimate. Find out how much you think find out how much your bill is going to be before you even get the services done. There is directions in your packet on how to get a pre-estimate done. We just want you to know how much your bill is going to be after the services are complete. Also, with MetLife Dental, we will not send you a dental card, but there is different ways that you can get a card. Like you can get it on the MetLife app, and you can also get it on My Benefits, and I'll go over that with you here in a little bit as well. Okay, next I'd like to go over our life and accidental death and dismemberment for you. So, the St. Joseph's School District is providing you basic life and accidental death and dismemberment in the amount of $50,000. And that's awesome, because I do see quite a few, and this is a good amount. So, then also, if you do want to supplement your life policy, your basic life policy, and you do want to add more, for you as an employee being a St. Joseph School District, you can get a supplemental life amount in increments of $10,000 up to $150,000. And if you would like to buy a supplemental life policy for your spouse, you can get a $10,000 supplemental life policy for your spouse and a $5,000 supplemental life policy for each dependent child that you have. So with the MetLife Life and AD&D, we do have advantages that come with it. One is the face-to-face grief counseling. Another is delivering the promise. The next is the total control count. Will preparation, estate resolution services, thewillcenter.com, funeral planning services, and RetireWise. I'm just going to go over a couple of the main ones with you because I think they're very important. One is the grief counseling. This comes with your employer-paid life policy, and this provides you, your beneficiaries, your spouse, your dependents, counseling if you go through if you have a loss, or if you're having a hard time, say like going through a divorce, loss of a job, if you lose a pet, if a loved one passes away, just a lot of different scenarios. And you can get a face-to-face consultation, or you can do it over the phone. It's up to you. And the next one I want to go over with you is the will preparation. If you do enroll in our supplemental life, you are able to get a will created or a will updated. And like I said, I know a lot of people don't know they have this available to them with the supplemental life, but you do. So if you don't have a will created, use that benefit. So like I said, if you already have one, if you need updated, feel free to use it. We can do this through our Hyatt legal attorneys. You do have the instructions in your packet. If you do want to get one, you just call Hyatt Legal. They will find an attorney in the area for you. And you just get an appointment set up. Then you can see if you can get your will created. And if you do not want to use one of our Hyatt Legal attorneys and use one of our non-network attorneys, you're able to do that as well. But you will have to pay for the service up front, and we will reimburse you based on your fee schedule. So I highly encourage you to go in network, because if you go in network, you do not even have to file a claim for it. They deal directly with MetLife. Next is your vision plan. We do have a wide variety of coverages with our vision plans. We do cover things like the ultraviolet coating, the polycarbonate lenses for children. We do have fixed copays. You can use any provider you would like, but it's just like our dental plan. We ask you to use our in-network, so that network, because it'll just save you more money in the long run. I was told your previous carrier is VSP. The good thing is we use VSP's network as well. So, like I said, you are able to use out-of-network coverage, and we do have, and our network is really big because, like I said, it's VSP's network. So first I would say, let's go a little bit over your plan. You do get an eye examination once every at a 12-month frequency. If you do go in network, it is covered after just a $10 copay. Now, if you decide to go out of network, it's a reimbursement. If you do go out of network, you pay for the services, you file a claim, and we will reimburse you based on your fee schedule. So like I said, if you go out of network, we only cover up to $45 of allowance. So you can see the difference on how much better it is to go in network. Your material eyewear, you either get glasses or contacts, allowed for frequency. It is a $25 copay. Your standard corrective lenses, it's also a $25 copay if you go in network. Like I said, if you're bifocals, trifocals, single vision, it's a $25 copay, and you can get those once every 12 months. If you go out of network, the single vision, we only cover up to a $30 allowance. If you go out of network, bifocal, $50 allowance, trifocal, $65 allowance, and lenticular, $100 allowance. So your standard lenses, like the ultraviolet coating and the polycarbonate for children up to age 18, see those are covered as well in network, just after a $25 copay. Progressive lenses and the polycarbonate and the scratch resistant, all of these, we do have a negotiated copay if you do go in network. Sorry, I was not provided these, but if you do go on My Benefits, you will be able to see those co-payments. Frame allowance. Okay, so you do get a $170 allowance for frames once every 24 months. If you do use Costco is in our network, just the allowance is a little bit smaller because their frames are already on a discount. So if you do go in network and you do use one of our in-network products besides for Costco, and you do buy a pair of frames above the $170, you will get 20% off the additional amount when you exceed that $170 allowance. So you will save more money by going in network. If you go out of network, it's only a $70 allowance. And like I said, frames, you are able to get those once in every 24 months. Contact lenses. You are able to get an examination and a fitting once every 12 months, and you will be covered in full after a co-payment not to exceed of $60 in network. You are able to get elective lenses once every 12 months as well, cover up to a $170 allowance. Say out of network reimbursement, it's only $105. If you do require contact lenses, like for any medical conditions, it's covered after your eyewear copay at $25. And that's every 12 months as well. So also with MetLife Vision, you do get some discounts, like you do get a discount of 20-25% off other lens enhancements. You do get 20% off additional pairs of prescription glasses and non-prescription glasses, and even sunglasses. And even if you're thinking about LASIK, you do get 15% off the regular price or 5% off the promotional price. And these are all for just in-network locations. Okay, and so this is the My Benefits. So we do recommend you use to download the My Benefits and get signed up with it. With My Benefits, you can view your ID cards, your enrollment status, you can check your claims, and you can even find more educational tools and forms on the My Benefits. It's like, if you do it, you just get things quicker that way than deciding to call our 1-800-GET-MET-8 number. Okay. So if you do have any questions, feel free to call us at 1-800-GET-MET-8. Like I said, we're open. And so for any questions to you, so if you have any questions, please let us know. And you can, and for any other questions, you can go to www.sjsd.k12.mo.us/page/9373. And if you do have any other questions, also feel free to reach out to Britton.
I'm Valerie with Blue Cross and Blue Shield. Thank you for being here this afternoon so we can review your 2017-2018 medical plan designs. I've given you some information. You have some summaries for each of the plans I'll talk about today. You also have a member guide. We'll refer to both documents or all of the documents and the PowerPoint presentation. And I think with everything that we talk about today, all of your reading material, hopefully by the end of the presentation, you'll be able to make a good decision for you and for your family. We are still offering the same 3 plans, and good news, no plan changes for 2017-2018. But the reason why we're having these meetings today is because open enrollment is a good time of year to evaluate your medical plans, make decisions on if you'd like to stay on your current plan or change to one of the other plan options. We will continue to offer Blue Care, and you have a separate summary that will be labeled Blue Care HMO. Some of the features to your Blue Care plan. You do have to pick a primary care physician. Blue Care is in-network only, and the network of doctors and hospitals is in the Metro KC area or in the St. Joe area. All right, if you're on the HMO plan and you use a non-network provider, you will have no coverage at all. So there's some restrictions on the HMO. Your second traditional plan is called Preferred Care Blue, and you have a separate summary for Preferred Care Blue. This is a PPO plan, or a Preferred Provider Organization. This plan offers a lot more freedom, a lot more flexibility. You don't have to pick a primary care physician. No referrals to specialists. You have in-network coverage as well as out-of-network coverage. The name of the local network is Preferred Care Blue, so you can use that right here in the St. Joseph area or in the Metro KC area. And then you also have access to our national and international network called Blue Card. And this allows you to take your benefits with you where you travel. We'll touch on that in just a little bit. The third plan that we're offering is the Consumer-Driven Health Plan. And your benefit summary will be labeled Preferred Care Blue / Blue Saver. This is the Qualified High Deductible Health Plan. It has a lot of the same features as your traditional PPO plan, so it will use the same network of doctors, hospitals, and providers here locally or even the national network. You still have in and out of network coverage, but where you'll start seeing the differences on that high deductible health plan is if you are enrolled in that plan, then you also have access to the banking piece or the HSA or the health savings account. Your health savings account will be a way for you to put aside money and pay for your eligible expenses in a tax-deferred way. Very similar to a flexible spending account, but there are some key differences, and we'll talk about that when we get to that portion of the presentation. All right, before we start talking about the benefit plan design, just a little bit about the website. For those of you that may have logged into mybluekc.com, you know that you have access to your own personal claims. If you need to print a temporary ID card, maybe you've lost your card and you need to always show that card anytime you have a service, you can go on mybluekc.com and order that temporary card and then go ahead and order the replacement card. You will have access to your claims, your EOBs, finding a provider, all available, but you do need to make sure that you log in as a member. So if you haven't taken the opportunity to do that, please do so. A little bit more about Blue Card, and that will be available for the traditional PPO plan as well as the Consumer-Driven Health Plan. Now, I mentioned the local network, Preferred Care Blue, but for those of you that may have a dependent child, maybe going away to school outside of your home area, they can have a provider wherever they attend school. They can have a provider right here when they come back home to visit you. If you have a medical diagnosis and you decide that you would like to go to the Mayo Clinic, MD Anderson, Johns Hopkins, those are some of our major facilities, you have access to those providers through that Blue Card nationwide network. Your only responsibility would be to make sure that you check the website, see what doctors, what hospitals are available outside of your home area, and then find that provider, use that provider, show your Blue Cross ID card, and you will receive your in-network benefit as if you were right here at home. It's also handy if you're on vacation and someone has a medical need, then you can find a provider wherever you're vacationing and still have your Blue Cross benefit. You'll also note that you have access to providers overseas, so we are available in 200 countries worldwide. Always keep that Blue Cross ID card with you. It'll have the toll-free phone numbers in case you need to call and find a provider while you're traveling. All right, a couple of things we've added to the plans. One thing that we've added, it's called Amwell, or telehealth. And when you're looking through your member guide, you'll have some information about Amwell on page 28. This is a way for you to kind of FaceTime with the doctor. All right, think about those times when maybe you've had a minor illness, or you have a child that has an ear infection. It goes on kind of that one time of year. You know exactly what's going on, but you don't have time to leave the office, or you don't want to leave the kids at home to take another child to the doctor. Then you can download this app, actually talk to a doctor 24 hours a day, 7 days a week. The doctor will diagnose you, diagnose the child, and then send a prescription to the pharmacy of your choice. And you've done that right from the comfort of your home. All right, it's handy, it's available for all 3 plans. You can refer to your benefit summary to find out the cost for this Amwell visit. We also introduced something called RX Savings Solutions. All right, at Blue Cross, we're trying to really encourage you to be a good consumer. No matter which medical plan you choose, we have to be better consumers, good consumers on all 3 plans. So this is a way for you to find out with your prescription drugs whether or not there is a cost savings opportunity, either by changing to a generic prescription drug or a lower cost name brand drug, changing pharmacies. All right, those are all ways that we can save money on our prescription drugs. To get more information about RX Saving Solutions, you'll refer to page 36 in your member guide. All right, routine preventative care. You all, if you don't listen to anything else that I talk about today, this is probably the most important thing, because this is how we keep our healthcare costs down. By going in for the annual physicals, the well women exams, the PSA test for the gentlemen, the well baby visits, all of that is available on all 3 plans at no cost. No copay, nothing subject to your deductible, no out-of-pocket expense, but the key to that 100% coverage is to make sure that you visit an in-network provider, make sure that your services are truly routine. In other words, you have not been diagnosed with something, you're not taking medication to treat something, you're there because you're well and you want to maintain your wellness. That's what we call routine preventative. And then also make sure that your annual exam is done in a different calendar year. It does not have to be exactly 365 days from your last date of service. All right, so if you've already had your routine care done in 2017, just wait until 2018. It will still pay and process at 100%. If you refer to page 9 through 13 in your member guide, you will see the list of all routine services covered on all 3 plans, and once again, no cost to you. Right? So you all make sure you do that. Once again, this is how we are keeping our healthcare costs down. Plus that, you get to come to work every day happy and healthy when you're get that routine exam. Other added value services will include Blue 365. This is a discount program available for all 3 plans. Let's go ahead and start our review of your traditional plans. So we'll start with the HMO and PPO plan options. And once again, no plan changes. But I'll just go through this in a little bit of detail for those that are thinking you might want to change from one plan to another. So as we start at the top and we talk about Blue Care, remember this is the HMO. This is the plan that has the restrictions. You'll notice when you look at the plan, everything is copay related. So on this plan, you don't have a deductible, you don't have any co-insurance, everything is a flat dollar amount, pay as you go. You have a copay when you visit your PCP or your primary care physician, it's $25, $50 when you visit a specialist. You do not have to get a referral when you want to see a specialist, but the specialist, the primary care physician, any other provider has to be within the Blue Care network. You also will have a copay if you are hospitalized or have an outpatient surgical procedure. Your copay responsibility for inpatient stays would be $400 per day, but it maxes out at 3 days. So if you have a hospital situation and you have to be hospitalized for 5 days, you're responsible for the first 3 days, and then we take over and pay 100% for the other 2 days. Same thing with your outpatient occurrences, okay? So it's either 3 inpatient occurrences or 3 outpatient or a combination of the 2, but the maximum exposure for inpatient and outpatient is $1,200. Let's talk a little bit about the special scans. $100 copay if you have what's called a high-tech scan, like an MRI or a CAT scan, if it's done on an outpatient basis. So in other words, if you're hospitalized and your doctor orders an MRI, that's all lumped into that hospital stay. right? You will not be charged a separate $100 copay. Once again, that's only if it's done on an outpatient basis. And then finally here at the bottom, let's talk a little bit about what's the difference between urgent care and emergency care, right? Urgent care are those things that are, you know, it does require immediate medical attention, but it's not life or limb threatening. So you'll use your urgent care centers for those minor things like the cold or the ear infection, someone had a minor cut or abrasion, something like that, that's when you use urgent care. The emergency room is truly life or limb threatening. Right, you go to the ER, if you use it as an urgent care center and they treat you and release you, then you're charged a separate $100 copay. All right, this will be another way we can keep our costs down by using urgent care instead of the emergency room. So no plan changes to your Blue Care plan. All right, let's look at the traditional PPO plan. A couple of things you'll note about this plan. All right, you see the screen is divided up into in and out of network coverage. So remember, the PPO plan offers both. You maximize your benefit by staying in network. For the purposes of the meeting, we will talk about in-network benefits only. And then as you start at the top on this plan, it has the deductible. Blue Cross's deductibles always start January 1st, goes through the entire calendar year, and then deductibles reset January 1st the following year. All right, I'll talk a little bit about what happens for anybody that's on a plan right now and you decide to switch to a plan that has the deductible, what will happen to your expenses July 1st when we make this change. But let's get to that in just a minute. All right, also keep in mind that your deductible on this plan is for major services. You're hospitalized, you have an outpatient surgical procedure, you have to purchase durable medical equipment because maybe you've sprained your ankle, you've got to get some crutches. All of those services are subject to the first $1,000 in the calendar year. You only have to satisfy your deductible once. After you satisfy that $1,000 as an individual and you stay in network, then the plan will pay at 80%. We pay 80%, you share in the cost at 20%. Your maximum exposure for major services is $2,500. So that is also referred to as your out-of-pocket maximum, your peace of mind number. If you have an accident, major surgery, a chronic condition, an illness in the year, you know that $2,500 is where you stop paying for your services. Blue Cross will start paying at 100%. And so this $2,500 includes your $1,000 deductible and your portion of the cost sharing, or the 20%. So all of that goes toward that out-of-pocket maximum. When everything accumulates to $2,500, you go back into the hospital, you don't have to pay anything for the rest of the calendar year. All right, I want you to remember I said the out-of-pocket maximum includes deductible and co-insurance. I didn't say it included any co-pays. So this plan, your PPO plan, does have co-pays for your medical services. You'll notice the office visit copay is just one, $25. You don't have a split copay like you did on the HMO. So it doesn't matter what type of provider you're visiting, you pay a $25 copay, whether it's the general practitioner or the specialist. You also have a copay for your urgent care, $25, and your ER copay if you're treated and released, a $100 copay, then your deductible if you have not satisfied that, and then the 20%. So you all, my point here is if you have that major, let's say you have knee surgery, all right, and you satisfy your deductible, you pay that 20%, the surgery, the MRI, all of that totals $2,500. And then after your knee surgery, you have to go in for some rehab, or you have to go back in and visit your provider, or you have to get some pain meds because your knee is feeling achy. All right, those co-pays are still your responsibility even after you've satisfied that $2,500. This is an important difference when we start talking about the last plan, the consumer-driven health plan. And I'll just point out here on the right-hand side of the screen, if you use a non-network provider after your deductible, then you do have more cost sharing at 50% up to a higher exposure. Please note, you can be right here at home and use a non-network provider, and then you can be traveling and still use a Blue Cross network provider, all right, through that Blue Card program. All right, so I don't want you to confuse network with being out of area. All right, you can be in area and use a non-network provider. You can be out of the metro area and still use a provider that's contracted with us, okay? All right, last thing we'll talk about on the traditional plans is your prescription drug copays. Good news, no changes. All right, you have 3 tiers for your retail pharmacy. The first tier is the generic, lowest cost. Second tier, those are the familiar name brand drugs. And that third tier, those are for the newer drugs that are out on the market, kind of those, designer drugs, and they will have the highest copay. We have designed our program so that anything in the third tier with the $45 copay will have a substitute in either tier 1 or tier 2. So if you're trying to save money on your prescription drugs, you can do a little research through that RX Saving Solutions, or you can talk to your doctor or pharmacist and see, is there something else I can use instead of that higher cost tier 3 drug. You also have a savings opportunity by using Express Scripts, the mail order drug program. This will be for maintenance drugs, something you're taking on an ongoing basis to treat a chronic condition. So if you're using something, high blood pressure pills, something to treat your allergies, something like that, get that through Express Scripts. You get a 102-day supply for 2 copays. And your booklet will tell you how to get started with Express Scripts, and there is a member profile and a postage paid envelope in the back if you want to get started. All right, so those are the traditional plans. Let's go ahead and talk about the Blue Saver high deductible health plan with the HSA. All right, as we review this plan, I want you to keep in mind a couple of things. All right, you'll see it's divided up into 2 parts. The first part of the plan is the insurance part, the medical part. We talked a little bit about its Preferred Care Blue. That's the network that you'll use. You still have those same great features of in and out of network coverage, and you can also take your benefits with you where you travel. The other thing to keep in mind about this high deductible plan, there are no copays. All right, we talked about copays, office visit, urgent care, ER, prescription drug copays on the first 2 plans. On this plan, every dime, dollar, penny that you spend for your medical and for your prescription drugs helps you satisfy your deductible. After you satisfy your deductible in the calendar year, the plan takes over and pays 100%. It's a very easy, simple plan to use. You also will have a lower monthly premium, and I think you have your premium. You can refer to that so you can see the differences in your premium. Anyone can enroll in the high deductible health plan. Part 2 of this consumer-driven health plan is the banking piece, or the savings account, the HSA. In order to open the health savings account, you have to be on this plan. All right, so that HSA, similar to a flexible spending account, but the health savings account is only for the qualified high deductible health plan. A very important difference between your HSA health savings account and your FSA, your flexible spending account, you actually own this account. It's a true bank account. All right, so any money that you put in this account belongs to you. If you use it, that's great. If you don't use it at the end of the year, at the end of the plan year, you will not lose it. So there's no use it or lose it. I like to refer to your HSA. It can be a health spending or a health savings account. It's entirely up to you and your family how you use it, depending on your medical needs. And yes, use it for eligible expenses, medical, dental, vision, and you save taxes on that. UMB will administer your health savings account. So first, let's review the medical plan so you'll understand how this works, because I said no copays. So if this is the first time you're using this plan and you go in, what's going to happen? All right, you will show your card just like you always do. You do not pay for anything at the time of your service. You want everything to run through the Blue Cross system so that you can get the discounts. We'll talk about that in just a minute. But I want you to just see this plan doesn't have any copays. I also want you to see that the deductible, the maximum exposure for an individual is $2,600. Every dime, every dollar, every penny that you spend goes toward this $2,600, and then after that you have 100% coverage. Notice your deductible matches your out-of-pocket maximum for the individual. Right? Remember, it's a PPO plan, so you do have a non-network level of coverage, and we won't really talk about that, but you can see that you do have some cost sharing up to a higher out-of-pocket maximum. All right, let's talk about how the claims flow, then we'll come back to this slide. I want to make sure it makes sense to everyone. Okay, the doctors, hospitals, and providers, they can charge whatever they want to charge. They've signed a contract with us. That means they've agreed to our usual customary charges, our discounts. They've agreed to that negotiated discount. When you as the member go to that provider, your services are always based on the discount, not that full cost. So in this example, you're going in maybe because you have a cold and you're visiting a general practitioner, and that doctor charges $140. The negotiated discount is $65. Right? We don't want you to pay that $65 while you're at the doc's office because we want you to wait for your EOB, your explanation of benefits, and it will show full cost $140, discounted cost $65. You owe this doctor $65, and that $65 goes toward your deductible. All right, this is a simple example of an office visit, but any of your medical services, you'll wait for your EOB. This will give you an opportunity if you need to make pay arrangements, you know, if you've got a major medical procedure, major medical bill, and you need to make pay arrangements with that provider, you will be able to do that. All right, this is for your medical. For your prescription drugs, you still get a discount when you're using one of the network pharmacies. Same pharmacies that you would use on your traditional plan. So CVS or Target or Walgreens, all of those same pharmacies. But here's the difference. All right, when you go in to get your allergy medication and it's $150 and the discounted amount is $135, you pay that at the time that you pick up your medication, all right? You're not waiting for an EOB. You cannot make pay arrangements at the pharmacy. Whatever the discounted cost of that prescription drug is your responsibility. All right, I gave you this example. It's kind of a lower cost prescription drugs, but some of you may know that, you know, prescription drugs can be kind of pricey. All right, if you're thinking about this program and you are using a medication that's a little more expensive, we want you to make sure and do your research. We don't want you to have any surprises when you go to the pharmacy and the pharmacist says the discounted cost of your medication is $400. If you haven't planned for that, don't have a way to pay for that, that could be not a good surprise for you, all right? So we want to make sure that you are aware of that, do your homework, ask questions, call Blue Cross. Use that RX savings solution so you can research and find out the cost of your medication. Right? It doesn't mean the plan won't work for you, but you do have to be a good consumer and do your research. All right, so in this example, you're paying that $135 at the pharmacy. So when we go back, and I'm sorry, let me just also point out this. The cost of your medication is credited to your deductible at the time of your purchase. So that's why it will be so important. Always show that Blue Cross ID card when you're going in to get your prescriptions, because they'll run that, tell you your discount, and that amount goes immediately toward your deductible. So when we go back to look at this slide, all right, I gave you two examples, $65 for your office visit, $135 for your prescription drugs. You continue having medical and prescription drugs throughout the year, and everything accumulates to $2,600 as an individual. Then your plan takes over and pays 100%. You go back to the pharmacy to get a fill or refill on your medication, you're not paying anything. You go back in to have that rehab after your knee surgery, you're not paying anything for the rest of the year because you've satisfied your $2,600. For those of you that may be on the traditional PPO plan right now and you're thinking you want to change to this plan, any deductible amount that you've met on the current PPO plan will be credited to this plan, all right, because you're looking at a PPO to a PPO. If you are on the HMO plan and you're thinking about switching to this plan, any expenses that you've already satisfied on your HMO will not roll over to the PPO plan, because you're looking at two different concepts, two different networks, all right? So for those of you that are on the HMO, maybe talk to me after the meeting so you make sure you understand what will happen if you switch to this plan. All right, because July 1st, your deductible will start $2,600 through the end of the year, and then everything resets January 1st the following year. One more thing, and then we'll talk about the HSA. All right, this question comes up all the time. This plan has a $5,200 family deductible. And some folks say, wow, that's a lot of exposure for my family, but this is how it works. Let's say you have 3 people in the family, and one person has all the medical and prescription drug expenses, and they reach $2,600. We start paying claims on that one person at 100%. A second person, when they start having claims and they accumulate toward $2,600, Now we will start paying claims on the second person as well as the third person when they start having expenses. All right, so why are we paying on that third person? Because the first two collectively met the $5,200 family obligation. So my message here is one person in your family will never exceed more than $2,600. They won't be exposed to more than $2,600, and the $5,200 can be satisfied by either two people, each having $2,600, or a combination of all three folks having medical and prescription drugs for a total of $5,200. Right? I'll be glad to kind of walk you through that after the meeting if you'd like. All right, so we're enrolled in this high deductible health plan, and we meet the eligibility requirements. That means we get to open and contribute to the HSA, or the Health Savings Account. All right, we talked about the HSA is yours. It doesn't matter if you're working here, you're working someplace else. Let's say you have the HSA right now, and during this open enrollment period, you decide, I think I'll get back on one of the traditional plans. That health savings account still belongs to you. All right, but in order to continue your contributions to the HSA, you have to be on that consumer-driven health plan. You can let that grow. The balance grows and accumulates from year to year. You don't lose that money. And you have three ways that you can save money on taxes with this HSA. You can designate how much you would like to go into your HSA. It goes into the account tax-free. Take the money out for eligible expenses, you save taxes on that, and after you get to a certain balance in your UMB account, then you have some investment options, and those are also tax-free. I said earlier, this is either a spending account or a savings account, so you get to choose. All right, as you get older, you have more medical needs, you can treat it as a nest egg. I have this account, and that's how I'm using mine, as a little nest egg. All right, so what are the eligibility requirements in order to own and contribute to this account? You all please remember, now we're talking about the banking piece. I said earlier, anybody can have that medical plan, but this is an IRS governed plan, and so they want to make sure that you meet those eligibility requirements. And that would include, you cannot be on another traditional plan. So let's say your spouse has a traditional HMO or PPO plan through his or her employer. You cannot have your health savings account and be on that traditional plan. That's what's called first dollar coverage. You also, as the account holder, because you are the HSA account holder, you, the account holder, cannot have Medicare or Medicaid. You, the account holder, cannot have exposure to a flexible spending account. All right, so let's talk about that a little bit. Let's say your spouse has an FSA through his or her employer. Maybe you're not on your spouse's medical plan. Maybe you're not using their FSA, but it doesn't matter. The IRS says the household has one tax-deferred account they can use. Will it be for the flexible spending account, or will it be the health savings account? You cannot have both in the same household. That's considered double dipping, because you can take your health savings account, spend it on your spouse. They don't have to be on the district's medical plan. Your spouse can use their flexible spending account, whether they're doing it or not, but they can take the flexible spending account and use it on you, and you don't have to be on their medical plan. Now, dependent daycare, flexible spending account, yes, you can have that and the HSA. All right, and once again, you are the account holder. It's your responsibility to make sure that you stay within those guidelines. How much can you put into your health savings account? It goes up a little bit every year, and so the IRS has said that the maximum contribution for 2017 is $3,400 for the individual, and then $6,750 for the family. And you all, that is you and one other person, or two other folks, but anything other than yourself, then you can contribute up to the maximum. Now, your school district will be making, I think, a generous contribution to your HSA. It's about $85 a month, and we calculated that that's about $1,000 a year that will go into your HSA. So in order to stay within those guidelines, you have to calculate what you're putting in, what the school district will put in, and if you have any other source, but just make sure that you stay within those guidelines set by the IRS. If you are 55 years of age or older, so I mentioned I have this plan, If you're 55 years of age or older, I get to put an additional $1,000 into my HSA. That's what we call catch-up contributions, so that that nest egg will grow a little bit further, or go a little bit further for you. All right, and then for those of you that are thinking about the plan and you haven't been on it before, July 1st is when the plan is effective and you'll start making those contributions. You cannot reimburse yourself for some services that you had in June. The account has to be set up, you have to be on the medical plan, and then you can start using your HSA. All right, here are some of the qualified expenses. It's not the complete list. If you want to go on the IRS publication 502 for the complete list, you'll find out everything that's considered qualified. Once again, you're the account holder. You have to make sure that you stay within those guidelines. You'll have a UMB debit card, and it could be very tempting to swipe your card at Target and get your glasses, get your medication, but it will also pay for a big screen TV, okay? That's not eligible. What happens if you spend your money on something non-eligible? You're taxed on it and you pay a 20% penalty. All right, so who's going to know that? Who's going to monitor that? Okay, am I going to chase you around and say, you spent your HSA on something non-qualified? No. The IRS, if they audit you, if they come and knocking at your door and they find out that you spent your money on something non-qualified, that's when you'll have the penalty and the extra taxes. All right, how will you get your money out of your HSA? You'll have a UMB debit card, and once again, you can swipe that at your point of service. We suggest that you use that card. Maybe you can use it at the pharmacy, but for any medical services, the dental services that Tyler talked about, anything where there could be a discount, wait until you get your EOB and then pay according to the EOB. You can also set up bill pay, all right? If you have a provider that you're using consistently, then you can go on the UMB website and just have that money come directly out of your HSA to pay that provider, all right? So you've got a lot of freedom, a lot of flexibility. One last thing before we wrap it up. Here at the bottom, all right, you all, this is a true health savings account, which means you can only take the money out if the money's in there, okay? It's a bank account, simple banking concept, but I always need to point that out because when folks start looking at the flexible spending account versus the HSA, remember your flexible spending account, you designate how much you want for that entire year, and that full amount is available immediately. All right, if you designate how much you want to come out of your paycheck in the HSA, that if one deposit has gone into your HSA, that's all that's available for you to spend. All right, so that's going to be a key difference for those of you that may have some urgent needs right at the beginning of the plan year. All right, we'll wrap this up. I always like to give just a little bit of homework as you're making your decision at open enrollment. And so one of the things that I'd like you to make sure and review as you're thinking about your plan, how did you use your plan last year? What do you have coming up in 2017, 2018? What type of prescription drugs are you using? Annualize your premium. How much does it cost to be on one plan versus another plan? All right, it's so easy to just pick the plan that we always pick. It's so easy to pick the plan because of the premium. But I want to make sure that if you are thinking about that qualified plan with the HSA, that you think about those prescription drugs, you think about that risk tolerance, all right, that initial $2,600, that's all yours. There's no cost sharing until you've satisfied that $2,600. All right, so there's a lot of things to think about, but you all don't buy more coverage than you need. All right, there's a lot of times, and I do this myself, it's what I've always had, so that's what I always do, and I don't use the plan. Don't buy it if you don't need it, all right? It's the same way we would look at any other aspect of our consumerism. All right, customer service. This phone number is available. It's on the back of your Blue Cross ID card. And you can call them from 8 a.m. to 8 p.m. They can help you answer questions. If you leave the room today and you have some questions that I wasn't able to answer, you can call them and they can help you. All right, and we always like to remind you about those qualifying event changes that you can add someone to the plan, take someone off the plan throughout the year if you do have a qualifying event. Otherwise, open enrollment is your only opportunity to do that. And I always like to remind everyone about the newborn, because in the excitement of having the new baby, sometimes folks forget to add the baby, don't want them to go without coverage until next year. So if you're in that situation, visit your HR team, make sure you get the baby